It's an interesting case in that it has some features of a uncommon imaging diagnosis of anterior tarsal tunnel syndrome. And in that syndrome, what you have is compression of the deep peroneal nerve, maybe against the superior inferior extensor retinaculum. So the thing I usually try to do is go to my T1s and go along my deep to the superior extensor retinaculum, which these are extensor tendons. And I'm looking for the nerve, artery, vein bundle here, the dorsalis pedis, and I'm having trouble even distinguishing the nerve in this case, which usually I can see. In your T1, it's kind of blurry, but these are the nerves here, and one of these is the nerves here. I can see the superior extensor retinaculum, and I can't see the inferior extensor retinaculum, but I can see that the muscles are atrophied, the extensor musculature is atrophied, and also there seems to be some synovitis in the sinus tarsi itself, and I'm seeing that this is the anterior cervical ligament of the sinus tarsi is stretched and sprained, and I have some edema as I move along the extensor tendon. So my leading differential diagnosis from what I'm seeing here is going to be anterior tarsal tunnel syndrome. You can appreciate that more here with the muscle edema. Also, we can appreciate in the sinus tarsi itself, there are ligaments that go to the extensor tendons, and they're thickened here, and there's some edema to do with them. And those are called the roots of the extensor retinaculum. They may tell us something about the biomechanics that there's having trouble lifting the foot from the heel strike towards the forefoot. So that's what I'm seeing here is perhaps compression of the deep peroneal nerve against the superior and inferior extensor retinaculum and the edema that occurs with it. It would commonly cause swelling at night. I could see that. The other features of the case in terms of ligaments and things like that, you have a thickened ATFL, PTFL also mildly thickened, and calcaneofibular ligament mildly thickened. We can see that there's some deep deltoid thickening. Even the superficial deltoid is thickened. So we definitely see some chronic ankle sprains in this patient. The Achilles, not too bad. Plantar fascia also. Interesting, there's some osteochondral contusion along the infralateral talar head. When I see the talar head facetting this way, I do believe I'm looking at altered biomechanics. That is what I'm seeing here, the sinus tarsi inflammatory change, and that synovitis that's wrapping along the roots to the extensor tendons coming down. I think all of this, I would check and see whether or not there's a deep peroneal nerve entrapment in this patient. Very nice case.